KTAR News on 92.3 FM and the KTAR app for Android and iPhone. The Agenda with Joe and Monica.
Well, we all hear those myths about an apple a day keeps the doctor away, and you should brush your teeth twice a day for 2 minutes, and you should do this with your children and do that with your children.
Those are myths?
Well, that's truth. The second one is truth. 2 minutes twice a day.
I ate a bushel of apples before I got in here. I thought that was supposed to keep me cool.
Well, I ate some caramel apples last night.
That
so
I
should
know
be pretty
did
safe
not
for a while.
help you.
Well, we are joined today by Dr. Jeanette MacLean, and she's with Affiliated Children's Dental Specialists, and she's going to help us kind of go over some of these myths when it comes to teeth, especially, and what we can do to make sure that
not have to see her more than we need to.
Right.
Hey.
Yeah, exactly.
Fun to see.
Well, yeah, but
I am a kid's dentist, so
but how
it is
often,
a fun office.
But do you like to see those kids time and time again? I mean, like month after month?
What's recommended is twice a year or every 6 months, just like you and I. And, if you do follow certain healthy guidelines, that really is all that I need to see you, but not everyone follows those guidelines. So some people we see a little more often. And then there's the people you don't see maybe for years due to other reasons.
If you're a kid's dentist, Monica's got kids who are 4 and 7.
Yep.
When do the kids need to first show up? Can a kid wait until they're like 2 or 3?
Because I've been told by pediatricians that you don't have to show up till you're 2 or 3.
And I know that, like you said, every 6 months you're supposed to go. But when do you need to go for the first time? Because I had a friend who was in his 30s who'd been to the dentist like 3 times in his life. You would have had a field day with him.
That's a great question. And the answer is you should have your first visit by first birthday. And like what Monica was saying, all the time we'll have parents coming in when, say, the child is 3 and there's a visible cavity, and I educate them that about a third of children in our state already have cavities by 3. So if you're going with the old school recommendation or guideline, which was to wait until 3, you might be a little behind the 8 ball. So coming at 1, it's more about prevention. We want to prevent the cavities. We don't want to wait till there's a problem. We want to get them used to coming. We want to educate the parents about healthy brushing habits and healthy snack choices. So really the sooner the better.
So you just said there, I think I heard you say that a third of children in Arizona already have a cavity by the time they're 3.
Mm-hmm. And half by kindergarten. So it's really shocking.
I mean, does it really matter? Because those are their baby teeth. They're going to fall out, right?
Yes.
Yeah, just extract those things. Just get out the pliers and pull.
My next favorite myth. Your oral health is part of your overall health, number 1. So to see a child come into my office with cellulitis of their face, that's you could die of a dental infection.
What's that?
That's when a tooth is so decayed and infected because maybe the attitude was like, oh, it's a baby tooth, it's going to fall out. Well, what if it gets infected? And what if that infection, your teeth are connected to your body, right?
Yeah.
The same blood pumping through your heart is going through your teeth.
That's a good point.
They're vitally important to your health, number 1. And then number 2, the health of your teeth will affect your permanent teeth as well. So if a baby tooth got infected, it can damage the forming permanent tooth. Everyone wants to save money, right? Well, some parents always are nervous. Oh, is my kid going to need braces? Braces are expensive. Well, if you're allowing these baby teeth to rot, they drift together. If you're just pulling them, they're space savers for the permanent teeth. So you've basically hooked yourself into needing orthodontic care if you're just neglecting the baby teeth. And one extra thing is a lot of people don't realize how long they're actually there. Some parents are shocked when I tell them that the second baby molar in the average child doesn't fall out until they're 12 years old. Well, some is a little early, 9, some it's not until 14, 15. And then there's people like me. This is one of the most common missing teeth are your permanent bicuspids. I still have a baby tooth. I like to say I'm young at heart.
Wow, looky there.
So thank goodness my mom brought me to the pediatric dentist regularly as a child. And, otherwise I might be partially toothless here.
Oh, terrible.
We're talking with Dr. Jeanette MacLean. She's with Affiliated Children's Dental Specialist, kidsteethandbraces.com. That's right?
That is correct.
So you mentioned healthy snacks, too. Obviously, we're coming up on Halloween season.
My favorite holiday.
Num, num, num.
And I'm sure, my guess is my dentist always told me as a kid, you can have a little bit of candy around Halloween. I don't know any dentist who's like, no candy ever. You can't have any fun.
Right.
But how much like candy is too much? And is there some candy that's worse than other candy, or is all candy evil and equal?
Great question. I'm a big proponent of everything in moderation.
Okay.
And I love my candy, so I'm going to have candy.
Oh,
so
yeah.
It's all about, you can really have anything that you want.
Okay.
It's the quantity and the frequency when it comes to candy. So if your child decides to eat organic gummy fruit leather all day long, they're going to get a lot of cavities. Whereas if they were to have fresh fruit, or let's say you want them to have a candy, it's better to choose milk chocolate, like the Hershey Kisses versus the Skittles. And the reason why the milk chocolate is just going to melt away, it's not going to linger in their mouth that long. But if they eat fruit snacks or the Skittles, something in a sticky form, it's going to get stuck in the grooves and the molars, and it's going to last a lot longer and to do a lot more harm. And then if you really want to make it bad, give them something sticky and acidic. So like your Sour Patch Kids. That's
with like a Coke
dentist's
or something.
best friend. Yeah, wash that down with a.
You bring that up, and we went to the dentist a couple of weeks ago, and I was really surprised. Mm-hmm. We were talking about vitamins. They painted on the vitamins onto the
fluoride
kids'
varnish.
Yes,
totally.
yes.
Yeah.
And I said, hey, kiddos, that's just like the vitamins you take at home.
Mm-hmm.
And they looked at me and said, are you talking about gummy vitamins? And I said, well, of course. And they said, those aren't always the best. What do you say about that?
And it's great that they brought that up, because so many parents, when we discuss this, it's really an afterthought. You think, oh, I'm giving them a vitamin. This is fantastic. But it's the form of the vitamin. If you're giving them a gummy vitamin as they head out to school and they've already brushed their teeth, well, now there's so much sugar in the gummy vitamins. And now we were just recently trying to get some at the store, and they only had sour gummy vitamins. I thought, so my kids have the old school Flintstones chewable vitamins. I mean, that's what I had growing up. And there's different brands you can get. You can, you can find chewable ones at Whole Foods or whatnot, but getting the chewable vitamin, the crunchy one, is not going to linger as much. There's sugar in it, so I obviously brush after they've had the vitamin.
I had no idea.
And that's the thing. There's certain things that you would never even think of. So bringing your child to the dentist, we're there to proactively guide you to make good choices and
Yeah, no, I'm
help
glad.
Prevent the cavities. We'd rather have happy visits too. Trust me, especially working with children. We don't want your child there more than they need to be there, because we want them to like us and to have fun.
So let's
and
talk
that's with prevention.
Real evil stuff like brushing, flossing, all of that
Evil.
good stuff. Oh.
What do you mean?
No,
Mommy,
I'm tired. I don't want to brush.
No kid wants to do that.
Please, Mommy.
So does the toothbrush matter? Do Monica's kids need like the $150 electric toothbrush?
No, they don't need to have that.
When does the flossing have to start too? Because
as soon as
stink
your
with
teeth
the flossing.
touch.
Oh, as soon as your teeth touch.
So you could have a 9-month-old with 2 incisors that are jammed tight together that
they have to floss at 9
Oh,
months
sure,
old.
they already have stuff. It's not. There's not a magic age where, like, on your 12th birthday, you will begin to floss. Like, you should you want to get that into their routine, right?
Yeah.
We all have these routines
Yep.
as parents. Like, we take the bedtime bath, and then we read a story, and you want to add brushing your teeth and flossing, because you want to imprint it on their brain. So then when they go off to college one day, they have hygiene and oral health. Like you're trying to train them these good habits. So
Those
why
good
not
things.
start right away? And then really, it's as soon as the teeth touch, you can collect food particles between the teeth
that makes
your
sense.
toothbrush isn't going to reach, so you could get cavities in between the teeth. So you do want to.
But Monica
Start
doesn't
soon.
have to take out a second mortgage for a toothbrush yet, right? She
Correct.
can go with the cheaper toothbrush
You know
as
what,
long as they
though?
get the 2
I
minutes in.
should. It's a lot of parents will get the spin brushes, which are, I'm thinking in those terms, the cheapo battery powered ones.
Right.
Those are actually often too large. It's about
Yes,
the
they're
size
huge.
of the toothbrush head. It has to be age appropriate.
That's right.
Because sometimes they're so clunky, you don't actually reach the molars in the back. So you could actually do a worse job if you get the wrong size. So I do recommend the children's Sonicare toothbrush, and that's a little tiny,
it's
a
small.
different technology. I mean, we all have iPhones, right, or smartphones. So, why, a stick with bristles is really from caveman days. So there is truth in having
my stick with
Sonic.
bristles is no good at the
It's
end.
still good.
No, I can't be brushing with my finger. That doesn't get the job done.
There was a product like a little finger brush. But no, a Sonicare legitimately is, I think I always say that's like, the Mercedes-Benz of toothbrushes.
We have, it's not Sonicare, it's Oral-B, but I went
and
and got
that's
them
another
the
great
electric
brand.
toothbrushes because the heads were smaller and they could get back to their back teeth.
Right, which is very important.
And you mentioned flossing. They make those little kid flossing sticks that are fluorescent, and the kids like them.
It makes it fun. They could pick it out. You can actually fit it in their mouth instead of trying to get your big hands in there.
That's right.
So, really it's whatever you're actually going to use. That's the brand that we recommend.
So we're here with Dr. Jeanette MacLean. She's with Affiliated Children's Dental Specialists. It's kidsteethandbraces.com. And you know what? You've given us a lot of great information today.
Well, thank you.
That a lot of parents, I think, they don't know because sometimes they can't get to the dentist. They might not realize the right questions to ask.
There's a lot of stuff parents have to know, too.
Seriously.
I mean, Monica's got her 854 hats. I mean, it's nice to just be able to have a dentist who you can just say, hey, what the heck should I do?
Right.
And the dentist just gives you the 2-minute rundown so you don't have to go and read a 400-page book on it.
Right.
Yeah. I agree. And I'm a mom myself. I have 2 children as well.
Do they have cavities?
Ages 3 and 5. No, they do not.
So, see, you know what you're
but
doing.
But they do eat candy.
But you make them brush right
shoes,
after.
But it's not all day long.
In moderation.
And we brush morning and night whether they like it or not. Because, this is a common one we'll get. The parents will come in and say, but he won't let me brush. And I just think,
really?
I mean, of course, I keep those thoughts to myself, and I'm always encouraging. But
what do you say to that parent who comes in and says, "My kid won't let me brush"?
I put it this way:
you say waterboard them,
when
right?
when it comes to health and safety, these things are non-negotiable. And I like to give the analogy, when my 3-year-old, now she's 3, but when she was an infant. She wouldn't let me or didn't want me to change her poopy diaper sometimes. Do you think I would let her sit and poop all day? No. Well, the plaque is basically bacterial, on your teeth. So if that doesn't make you want to brush, I don't know.
Oh, my God. I don't know what does. Using that.
Right, but you're the parent, and this is the rule. Or sometimes throwing a fit to get in the car seat. You think I'm going to drive down the freeway without my child secured in the car seat? No, you're getting in the car seat, and I'm buckling you into it. It's non-negotiable. It's always the easy thing to give it. Like, trust me, I'm tired after a long day at work, and I come home. The last thing I want to do is to fight with my own children to brush their teeth.
Yes.
So the easy thing would be like, okay, fine, maybe tomorrow. But
I've done that before.
Right. The laziness, it starts to add up, and it does eventually catch up with you in the form of cavities. And the main thing here is this is largely preventable.
Yeah, you're right.
It's a lot of people don't realize it's the number one most common chronic disease of childhood.
Yeah.
Oh, cavities. Wow. You talked about asthma earlier in an earlier segment. Did you know that cavities are 5 times as common?
No, I didn't know that.
Cavities are 5 times as common as asthma. I mean, it's shocking. So
get your kids to the dentist.
Yes.
Do a little bit of research. Be careful with candy. Give them chocolate instead of the gummy stuff
if
necessary. And 2 minutes twice a day.
Absolutely.
And it's non-negotiable.
That's right.
There we go.
Dr. Jeanette MacLean, Affiliated Children's Dental Specialist, kidsteethandbraces.com, kidsteethandbraces.com,